people that went after Betty talked in Baton Rouge. I wasn't at the meeting. Okay, sorry. I wasn't at the meeting because I was sick that day, and that was pretty much a common thing for me. I was always sick. I was always tired. I was always home in bed. I was never doing anything. I never did any family events. I never did anything with my friends. I just couldn't do anything. And I got really sick, and I, started having a hard time walking. So went to the neurologist, and it turns out I had advanced with my MS, and I was no longer relapsing or remitting. I was secondary progressive, which is not a good thing. So I started having to walk with a cane. 35 years old, you're walking with a cane. Kind of sucks. So they put me on chemotherapy to kind of calm my immune system down, help me get off the cane. Well, as you can read on the little flyers they did for us, it was great. I started walking, no problem, didn't need the cane, but I had all the side effects of chemo. And I thought to myself, I don't have cancer. Why am I on chemo? What's going on here? This is ridiculous. So what Betty failed to mention was one of the community newspapers did an article about her. And it talked about her trip over there, what they did. So my family saw it, and they said, well, what do you think about this? And I thought, that's a good idea. Well, after the first treatment of chemo, I was like, well, I'm going to be okay. And then all the side effects came, and I was like, that's it, we're going. So we signed up and we went. So my mom and I flew over there, and we were lucky enough to be in Qingdao when David was there for his second round of treatments. And it was the best thing I think I've ever done in my life. We had a really great PT guy. His name was Martin, and he pushed you, and he did the best thing he could ever do for you. He had 3 goals for me. I was going to learn how to jump, I was going to learn how to balance on one foot, and I was going to run. And before I left there, I could do all 3. And now at home, I'm tired, but I'm tired because I'm doing things. I'm going to work every day. I'm going to the gym. I work out with a trainer, and my trainer kicks my butt. There are days when I am so tired and so sore, but it's because my muscles, there's lactic acid buildup from pushing myself so hard. And I couldn't have done that before. I went to a haunted house with my friends, and I walked for 45 minutes up and down different levels, across suspension bridges, had things chasing after me, had clowns up in my face. And these were things, they're little things, but they're things you miss, things you don't get to do. And I get to do them now. And if somebody was to ask me, would you do again? In a heartbeat, It was a long trip over there. I'm not going to say the trip there didn't suck, because, frankly, being cooped up on a plane for 14 hours does kind of bite. But you do have your little TVs you can watch the movies on. It'll keep you entertained. But the Chinese people were amazing. They all wanted you to succeed. Everybody was invested in you succeeding and feeling better and doing the best that you could do. And you're immersed in a healing environment, and the people you encounter are some of the most upbeat, positive people who are hopeful and helpful, and they remind you who you truly are and let you know that you're a great person, and that what you're doing will matter, and what you're doing will help others.
I would imagine you noticed that sign right there on the wall behind you. It says U.S. Stem Cell Awareness Mission. That is really what I'm all about. It's the U.S. Stem Cell Awareness Mission. And this is our mission statement. We are, each one of us, Americans with conditions our U.S. doctors have told us were untreatable, merely manageable, degenerative, unheard of, regressive, terminal, or orphan. We witnessed the opportunity presented by adult umbilical cord and blood stem cell therapies outside our borders. Many of us have questioned these terms by which our doctors labeled our conditions. And by the way, there's doctors sitting here, and I'm not saying this about all doctors, because Dr. Klein, from the very beginning, was so open-minded.